We can play the Jeopardy game really quick, or we can just go through more of the question and answers. Which would you rather do?
Do this and
Jeopardy.
That's great. Okay, Moab, your turn. Choose one.
All right, let's take definitions for 30.
What is an antigenic drift?
Antigenic drift is changes that occur, changes on the virus that occur so that it changes its resistance.
Okay. Drift is the main part of this.
it's just small changes.
Drift is the main part of it. It's
Yeah.
due to mutations.
It is due to mutations, you're right.
Is it a change in the spike?
Okay,
It
I think
changes
maybe
the
I'm
spike.
missing then.
There's more to it, is all I'm saying. There's an antigenic drift and there's an antigenic shift. What is the difference? What is the
Yeah, I
difference?
remember.
It's all good. A drift is from year to year. You're just drifting, okay? It's just coming and going. It's la la la. You know, not a real big plan. It's just year to year. It is classified as a minor antigenetic change of the makeup of the spikes. This could lead to the epidemic. So how I remember is it's just drifting along. It's not that big. It's only a small minor epidemic. No big deal. But it changes every year to year. And this is why you have to have a new influenza shot year to year, because it changes. Good job. All right, Logan, let's choose one.
How about respiratory system for 50?
Sweet. What is the definition of walking pneumonia?
Like the kind of bacteria that cause, or like,
Sure.
So it's the Mycoplasma pneumoniae.
Okay. Wait, I know that voice.
That's Abby. Hi.
Oh, hi! I'm glad you made it.
Yeah,
Oh, wait,
I did
she's
too.
right.
Stayed in Logan today. Sorry.
It's all good. I'm glad you're there. All right, what else? What is unique about walking pneumonia? That was right, by the way, but what else? Can you add on to it?
It lacks cell walls,
Mm-hmm.
and it. Alicia says, because she's here too, and she's being quiet. She says it causes primary atypical pneumonia, and
Okay.
it's also, aren't they like, is it pleomorphic or
Good job.
pliomorphic or whatever it's called?
Polymorphic. Very nice. That's exactly what I was looking for.
Perfect.
Yay! What does polymorphic mean?
Means that it can like change in a bunch of different shapes,
Good job.
like through kind of a thing.
Good job.
Go for 60.
All right, let's go Brigham.
Urinary bladder for 60.
Sweet.
Go big or
Bigger
go
go
home.
home. Aight. What is gonorrhea? How is it diagnosed?
Hold on.
What type of bacteria causes this? Neisseria.
Nice area.
Whatever.
Nice area.
I can't say
Nice area. Gonorrhea. Oh, that's
Neisseria.
right. Nice area, yeah.
Oh, I still don't. Yeah.
You can get
I'll never think of that the same.
Are you more susceptible to AIDS? Or either STIs? I don't know.
You're supposed to answer it. How's it diagnosed for first off? What is the difference between males and females?
There's discharge. A little pus. And
The
cake
froth
with women.
froth.
It's
The
deeper
what?
in women.
It is
You
deeper
can't
in
see
women.
it.
So it's not very, it's diagnosed very easily.
It spreads faster in males, right, the symptoms?
The symptoms spread faster because you can see them. You can't always see them in females. Yeah. Females are more highly susceptible to it, like 60 to 90% more, I think. Can't remember the exact, I have to look at the notes. But I know that they're more highly susceptible to it. Men are like
60 to 90.
Yeah, 60 to 90, and men are like 35 to 20.
20 to 35.
Good job. All right.
And it's diagnosed by,
Usually the pus. Usually there's there's a lot. In females, the early infection can go unnoticed. It's usually localized in the cervix, so you'd actually have to go inside the cervix, I would think. It's a gram-negative diplococcus, or cocci. It carries the risk of acquiring STIs, or sexually transmitted infections, including HIV, so you were right. This could also go into gonorrhea, arthritis, or meningitis. The bacteria attaches by their fimbriae, little hands, to the mucous membranes and proteins on the surface. So they bind the receptors of the helper T cells. So I would definitely know one way that they would, infect and keep infecting. They prevent the activation of the lymphocytes and turn off their proliferation. Any questions? Good? All right, back to Maud.
Okay, let's go respiratory system for 60.
Sweet. Blank, blank. This is yours, right? You did this one? Okay.
Yeah, I was thinking that it was alveolar phagocytosis, but that's not two words. That's not, there are cells in the alveoli that do the phagocytosis, isn't it? Or I'm thinking of the alveolar macrophages. Is that what you want? I'm confused.
Good job, you got it. The alveoli macrophages.
Phages, sorry.
It's all good. I understood. We're good. Sweet. Okay, Logan.
How about HIV for 60?
Okay.
I'm following suit.
What is a provirus?
Is that where, okay, I'm not looking at my notes right now, so I don't know if I'll remember for sure. But is this where it becomes, like dormant inside the cells, so like it can't reach it? Yeah, okay, hidden in the chromosome.
Nice.
Yay.
You are awesome, Logan. Sweet. All right, bring 'em.
Oh. Nervous system for 30.
60.
30.
60.
Good lord, 60.
You guys will probably get this. A little girl was brought into the ER. The mother says that she started to get a cold within the last 24 hours, and it has progressively gotten worse. She has been found to have nuchal rigidity. What does she have?
Meningitis.
Why?
Stiffness of the
They got really bad really fast.
Good job. So it got bad really fast, the nuchal rigidity, and also it usually starts out with a cold. So you don't really know they're sick until it's a little too late. Can't be the end of the show. Are you kidding me? Okay. You had 60, right?
numbers. I pressed about
Sorry, got my HIV for 50.
Okay. In which phases of the HIV infection do opportunistic diseases begin to occur?
In the second phase, when the T cells are between over 200 and below 500, I think.
Very nice. Ooh. Nice. Okay. Okay, Logan. Hit me.
How about HIV for 40?
Susan is a 34-year-old woman. Her personal history is of a healthy, sexually active individual. She came in with symptoms of weakness, fatigue, hair loss, and a slight fever. She has also said that she has had a rash on her skin a few days ago. What could she have?
Still.
Is this the? Are we talking about? Are you talking about the I can't say it. The cancer?
I don't know, am I?
Yeah, you're tricking me. It's the Kaposi's sarcoma. Oh, syphilis. Never mind. Jokes.
I'm not talking to anyone.
You are just fine. It's better to what am I trying to say, guys? It's better to get a wrong answer than have no answer at all. At least you know you're not on.
But you know, it has to do with AIDS, right? So we're all good.
It's all good.
Can you go back to the causative agent? Or did it have? Yeah.
Sorry.
No, you're fine.
Trypedema pallidum.
So this would be the secondary infection or secondary whatever it's called?
What is
the
the
second
bacteria
stage of
that
the
could cause this disease? So this is the bacteria.
I'm trying to tie it in with HIV.
Brigham, your turn.
You don't really have.
Okay.
I really don't. Digestive system 60.
Did you call me? You never know where they might be.
What's that?
What bacteria infection is treated with human stool animals?
Should we just try? I don't know.
Maybe.
Grandma will be there. I don't know, okay.
So they're trying to get more bacteria in. So which one is the one where it just all comes out? You're losing all your good bacteria that's in your
The
intestine,
normal,
right?
yeah.
You're losing your normal flora. So that's what they're trying to put back in there.
Oh, not okay.
It's nice that you put a smiley face by that one.
I know.
Well, animals sound just so great.
I'm trying to think positive here.
Okay, we're going normal flora. Is it C. diff?
Well, what's the
What is the bacterial
bacterial
infection
infection?
that's treated with human stool? So it's the one, like she was saying, I don't know if you guys can hear in Logan or Morad, but she was saying that you're losing all of your nutrients, you're losing everything. It's coming, all of your bacteria in your gut is leaving.
Clostridium difficile. Just because I cheated.
That's okay. Now you'll never forget.
Probably will.
Oh, probably. You're not supposed to say that. Okay, Moab, your turn, hon.
Might as well finish out the 60s, even though the last definition one wasn't so good for me.
It's so good. Sorry. It is 60 points. I tried to make it a little.
What do those words mean? Meningitis is the inflammation of the meninges, and then encephalitis is inflammation or swelling of the brain, and meningioencephalitis is the swelling of both.
Dang.
Or the inflammation of both.
Fire. Very nice.
I'm
Well,
all by myself here, so I gotta try.
go Moab. That's awesome. Okay, Logan.
200.
Thank you.
How about definitions for 50?
How does that work?
We just did that.
That is so not correct.
Syphilis!
That sounds like true.
Okay, here we go. What are the primary treatments? Supposed to be an S there. Are to replace lost fluids and salt. What are the primary treatments
are used to.
Are used to replace? Wow, man, I go college. Not very well. What are the primary treatments to replace lost fluids and salts?
The rehydration therapy,
Okay.
oral, and IV. Oh, and that last funny word.
That's I like that. Yeah, that's the line. It's out to use, but it's not very helpful.
So would he really like put that on a test kind of to push, like to trick you, do you think? Or would he really just kind of be like the rehydration therapy?
No, I would bet dollars that he would put something on there to trick you. He's like that. He's tricky. You know, we've taken his test.
It's tricky.
That was for 50. All right, Brigham.
Nervous system for 50. Ooh, fulminant progression. Fulminants. Come on, Chris.
I know.
Don't cheat. I wrote my own.
While you're looking in the book.
I'm not answering. She's on the page. Because I spelt it wrong and I was like, nah. It's in the side note.
What is this number? Nervous system?
I believe so.
Yeah.
Does that have to do with meningitis?
Does it?
I think so.
Everything we talked about.
Yes, we did. Okay, that was the meningitis where it starts slow as a cold and then bam, like next thing you know, they're just like, it progresses quickly.
There you go.
Exactly.
That's what I was looking for. Good job.
Rapid progression of symptoms.
Within hours.
I have a little note in my notes that says, know this term, but I still couldn't remember what it was.
Yes, that's a good one to know.
It is a good one. And also, I would know how to spell it. Just in
Yes.
case.
What is it again? Go back really quick.
It's in the
Fulminant.
nervous system. Right there.
Maybe you can think of something like I really want a mint. Because my breath is bad.
Full-
And I'll kill you in an hour.
I need a full mint. Like a full mint.
Oh, I need a full
Right now.
mint.
I need
Yeah,
a full mint right now.
I still have my bad breath.
I have mints.
Oh, see? I might need that. Lucky you people in Brigham and Moab. Not Brigham.
Logan.
I need more sleep.
Right there.
What was this one? 50? It was 50?
I don't remember even
All right, Moab.
That just means that it's quick.
Rapid onset.
Why don't you give me digestive system for 50?
Which virus causes jaundice?
Hepatitis.
What one?
Hepatitis A. But I would think they all would. But he really talked about hepatitis A and not the other ones. But I would think you would get jaundice from any of the hepatitis.
Because it's the liver.
Hepatitis.
If it touches the liver, yeah.
What's the other thing that it causes? Jaundice and you talked about something else, right?
I don't have those notes.
Which one's all right? We'll find
What's the
out.
question?
What else does it cause besides jaundice?
There's another word, I thought.
I'm looking at the notes now, so I'm cheating, but loss of appetite, weakness, nausea, diarrhea, abdominal pain, and fever.
Was that the other one? Was that the one where it was a stiff neck and if you tried to sit them up, their knees came up?
That's meningitis for little kids.
Maybe I'm just confused.
Oh,
Okay.
that didn't work.
It was all my email.
No gain.
All right, we'll take the 50 for urinary and bladder.
What circumstances would increase a UTI infection in women, and why? You went over this several times, so I would.
Yeah. The urethra is like shorter and wider,
Okay.
and it's closer to bacteria from the GI tract,
Okay.
and
How could you help prevent this? This isn't the question.
Front to back.
from the back.
Okay, what other things? That's the obvious one, but what other things?
Yeah.
Frequent sexual relations.
Good hygiene. That's an obvious one for you.
Yogurts, cranberry juice you talked about.
Oh yeah, the lactobacilli, the probiotics.
Good job. Okay, what is one more circumstance? Because all of those are correct, but there's one specific I'm looking for. This is something we haven't talked about. Well, he talked about, but we haven't.
Oh, catheter.
Okay, that's another one. No, but good job. I'm looking for a different
What are you
one.
looking for?
Starts with an E.
An E.
Uh-huh. And it's something that females need specifically. It's a hormone. Estrogen.
Estrogen.
Why?
Oh, estrogen.
No, it's your study. You tell me.
Folic acid. Yeah, it helps produce. Oh, yeah, the acid kill or make the acidic in that environment.
Estrogen in the blood causes the carbohydrate glycogen. It accumulates in the vaginal, whatever. Vaginal, thank you, lining cells. Lactobacilli then uses the glycogen to manufacture the lactic acid, which keeps the vagina to a certain pH and also kills most of the UTIs, all the bacteria. But good job with all of them. Yeah, that's pretty good. Right, so that was 50, right? Right, Brigham.
Definitions for 40. Next.
Is it plaque? Something like that.
Dextant
That has
is
something to
the,
do with plaque.
is
It's
the
made
build
by bacteria when they eat sucrose.
and they
You're on the right
attack the
track.
enamels and cause cavities. They feed off of it.
Yeah. Bacteria adhere to the teeth and produce a sticky material called dextrin. The accumulation of bacteria, dextrin, and debris is called dental plaque. Okay, so it did have a part to it.
Lisa, on the question you said, what is dextant? Was that just a typo?
Yes.
Go back to the
probably.
question. Okay, that doesn't look familiar. You meant dextran.
Yes.
Right.
Sorry.
No problem.
Yeah, sure it is. I need to get
It
it
kinda
more
looks
clearly
the
too. Okay, that was for 40. All right, Moab.
HIV for 40, since your cursor is close to it anyway.
Thanks. What is one reason why the anti-HIV antibodies developed by an infected person fail to prevent progression of the disease?
The reason why the HIV, because the T cells are being destroyed. I mean, because you have fewer and fewer T cells. Or because the virus stays latent intracellularly. Oh, yeah.
Good job. So far, Moab is kicking all your butts.
That's because they just win.
All right, Logan.
But she's one person.
One person.
She gets double points.
How about respiratory system for 40?
Martha is a nurse at the local clinic. A mother comes in with her 7-year-old son saying that he has the flu. He has congestion, lots of mucus, high fever, and diarrhea. Is this true? Does he have the flu?
No.
Why?
No, because he has diarrhea.
How could he have gotten this?
Something in... God. Why don't I just talk? I don't know, bacteria in the stomach.
Okay, that would be for the diarrhea. But you get the flu by droplets.
Yeah, so you won't have diarrhea if you have the flu.
Yeah, influenza does not cause diarrhea. Alrighty. Rig 'em.
Nervous system thing.
Meningitis.
Not funny.
Spinal tap.
Nice. Wow.
Yep.
Good for you.
I had a friend die of that in middle school.
Oh,
Are you serious? Yeah.
That's
And
horrible.
a lot of people had to be tested because if you shared soda with him or
Oh my goodness.
it was scary. So yeah, it's not because I'm like focusy.
It would be good if you could focus there. Hey, Mom.
Let's go urinary and bladder for 40.
What is the general anatomy of the urinary system? The differences between male and female.
Well, we've already talked about the fact that the women, females have much shorter urethra. So you have your kidneys, and then in both males and females, and then the urine travels down through, I can't remember what those tubes are called. Ureters? Okay. And yeah, sure, that all looks good.
I would know this as general because I would think he would put this inside of a question. So if you know these, it would help you out. If you don't, I think you could still deduce an answer from it, but if you know them, it would help you out. Just saying. Hi, Logan.
The last 41 for the digestive system.
Which bacteria produces an exotoxin, which is an introtoxin, that alters the function of the cells lining the intestinal tract, causing them to release fluids and body salts? And what is an effective treatment of this method for bacteria? Which bacteria produces an exotoxin, which is an introtoxin, that alters the functions of the cells lining the intestinal tract?
Vibrio cholera.
Good job. And how you fix that?
Vibrio.
Vibrio. I understood.
Oh, good.
And you do that through rehydration therapy. Alright. Here we go.
The one that your cursor's over.
What happens in severe cases of salmonella or salmonellosis or typhoid fever? What happens in severe cases of salmonella? And can this be treated with antibiotics? You're shaking your head, why?
I just can't see.
People can die from it.
Because it's kind
That would
of
be severe, yeah.
under GI intestine tract.
Bacteria invade the bloodstream, spread into the body, and cause more chance of death.
Nice.
And that cannot be treated by antibiotics.
Do you remember the reason why?
They have, well, I just have that happens because they have flagella, but I don't know, is that the reason?
Antibiotics don't work in the GI tract.
Well, there's nothing to adhere to.
Why don't they work as well?
There's nothing to adhere to or absorb, because your GI tract is your large intestine, not your small intestine. And in the small intestine, there is absorption, yes, but it's moving pretty fast. And then the stomach, I mean, you got acid in there. So the absorption part of your bodies, the biggest one is your small intestine. But it moves so fast through there that it stays longer in the large intestine, but there's little to no absorption, so it doesn't really help. That's the way I understood it. Okay.
I have nothing to add.
All right, so you got 30, right? You okay with that? I did. No, did I? No, I don't think I did. All right, Moab.
Hey, Trevi.
What factors can hasten a person's progression through the stage 3 or phase 3?
Three stages of HIV.
Oh, 3 stages of HIV.
Okay. Drug use.
Okay.
That would be a big one. I'm not sure what else. I mean, I would think poor nutrition and that sort of thing isn't going to help you at all in terms of your body fighting it off.
Yeah, malnutrition, that's one.
I remember that picture showed us those African Americans is all I can think of, but how they were all sunken and they were just it was not very pleasant looking. I felt bad for them. But malnutrition, pregnancy, other viruses.
Yeah, that's a good one.
Yeah, other viruses. So the age is a big thing too. So the very young or the very old. And the vaccination of immunosuppressants. What's up? Oh. But yes, drug abuse was one of the highest ones. And stress. We don't have stress. Who does?
All right.
I wish I could say that. All right, Logan.
How about 30 for the nervous system?
What is the most common way for microorganisms to enter the CNS or the central nervous system?
Trauma?
Good job.
Rabies. Yeah, rabies.
Good job. How does rabies get into the system? Do you remember? We went through a whole slide on this.
Yeah, he had it like that it had bitten his arm and it goes up through, doesn't it go? Yeah, it was like secondary and primary.
Nerve fibers to the brain. The
Peripheral nerve system.
Oh, the PNS?
Uh-huh.
And then it makes.
And then it like switches to the CNS? Is it through like the spinal cord?
I would think so, yeah.
That's what I would assume,
I
but.
would assume that too.
There's a solid like.
Mm-hmm.
What? Oh, I thought you said something. Sorry, my bad. Good job. 30, right? Yay! Okay, Brigham. The patient came in with otitis media and sepsis. What bacteria caused this infection?
Let's see.
The
two different things that cause.
What kind of pneumonia?
I don't know, we just barely.
We
did
just
this.
talked about it, yeah.
Streptococcus. Good job. Right, Moab.
Urinary and bladder for 30.
Oh, good. A patient came into the ER. He was 32 years old. He was male. He was on antibiotics for a lower urinary tract infection. His history stated that he was a smoker, a drinker, and sexually active. They took a blood test, and it showed that he was suffering from toxemia sepsis. What could this indicate?
Crap if I know.
Right on. Hey, guys, help her out. Logan, Brigham.
What category is
It's under the urinary bladder.
Is it gonna be?
E. coli?
Pyelonephritis. This is an inflammation of one or both of the kidneys involving the nephrons. The area in the kidney where the urine collects before it drains in the ureter. It looks really funny. That's the renal pyramid, and it comes down here, and it goes into the big gut.
It's caused by E. coli though, right?
And then it goes over here, well, it's not really looking like that, but it comes out here like this. That's the renal pelvis. It goes down into the ureter. So this is your kidney. Great. Anyway, it can lead to chronic diseases, kidney stones, which obviously are going to interrupt the flow. Do you remember that picture of the kidney with all of the little stones inside of it? Oh, that's amazing. Thanks. Obviously, this is going to lead to scarring or loss of kidney function completely. The causative agent is frequently gram-negative rod or Escherichia coli. So you were right on that. Okay, what is that?
I think it's her phone.
Oh, okay. Did I already give her points? How many points was it? 30?
Yep.
Hey, Logan.
How about definitions for 20?
This is easy.
Oh, you did.
I knew that one was coming.
All right, the shift is when it changes more drastically, so it's like over a period of like 10 to 12 years and can cause pandemics.
Good job. What is this called? Looking for a specific. It's not minor, it's
Major?
major. The reason why I'm emphasizing that is he might be using that to name it. So you need to know both names, antigenic shift or a major antigenic
Hey, are
change.
you gonna help me out?
Make sense?
You're on your own, buddy.
Moab's doing it, you can do it. Okay. Logan. Not Logan, sorry, you just did it. Brigham.
HIV 20.
What is the average time to go through all stages of HIV infection?
Depends on getting the treatment.
Well, no treatment.
6 months.
Good job.
Good job, Brian. There's your.
Oh, just
10 years. 6 months is when the antibodies start showing.
I forgot.
Yeah.
Okay, antibodies
But-
start showing up at 6 months. You're right.
But to
Sorry.
go from stage 1 to stage 2 to stage 3
is 10
is
years.
10 years. About.
My bad. I knew it was something. All right, Moab, your turn.
Okay, let's try urinary and bladder.
A young child about 4 came into the ER complaining that he didn't feel good. Personal history shows that he was seen yesterday by his pediatrician for a sore throat. Symptoms were a high fever and protein in the urea. What could he have? You guys can help her out too.
Could he have glomerulonephritis, I can't quite say it.
Why? That was very good, by the way.
Because that was the last thing left that wasn't a sexually transmitted disease, and I figured he was a little young for that.
Yeah.
Um,
Why else?
Because of the sore throat, and that could be an initial infection that he had, and then it led to the glomerulonephritis from
Okay.
Streptococcus. It's the one that begins with a P. We just talked about it when we were going over sore throats. You know, the various complications from sore throats.
Yeah,
Glomerulonephritis, which I can't say, nephritis was one of them.
It's all good. We understood. You can prevent it by quickly treating the streptococcal. So instead of waiting to go in to the doctor, hurry and get in there. Very nice. Okay, all good.
20 for nervous system.
Oh, you guys already know this one. Psh. I'm gonna go with 10.
Yeah.
Okay, what is the blood-brain barrier?
That's the part in your brain that like it chooses what it'll let in and out, like that'll let through the meninges to the brain. I'm trying to figure out how else to explain it. Like it protects it too.
I mean, hard because it blocks important antibiotics that you might need to get to your brain too.
That's very true. How does it block it?
I'm not really sure like exactly how it blocks it. I just know that it's like particular about what it'll let in and out. Like there's some sort of like door system in a way.
It's
what it'll let in and out.
speculatively permeable, and it's very tight junction. But very nice. I'm very impressed, though, Nick. Good job. Alrighty. Bring 'em.
You gotta give them a.
Bethany was a nurse in the ER. The first patient of the night was a 54-year-old woman who came in complaining of not being able to get enough air to breathe due to coughing. They took a swab and an x-ray and found a white mass on the x-ray. The swab showed or said that it was an obligate obligate aerobe, gram-negative, and was shaped like a coccobacilli. What could it be?
That's a 20 question.
Could be,
I'm gonna make you earn it, dude.
the whooping cough? No.
Why not?
Well, it could be the whooping cough. It's a white mask. I can't see the tuberculosis mask. Pneumonia. Yes, white is pneumonia.
You were right the first time.
Yeah.
Oh,
Because of the cough, exactly. That makes.
but that causes the white noise too.
Well, what does a normal x-ray look like? The lungs. They're black, right?
Right.
So if you have a white mass, it could mean pneumonia, it could mean whooping cough, because it always goes down below into the lungs. The biggest thing that one was showing is she couldn't breathe due to coughing.
Okay.
60%.
Okay, that's
You have to give Logan their points too. I think you forgot to give them their points.
I already did.
For the last
actually.
one?
Yeah, I really did.
Okay.
Because they were at the same time. Okay, Moab. I promise, Logan, I'm not
Digestive?
again. Okay, what?
Digestive for 20.
How long does it take for symptoms to appear from ingested preformed introtoxin? And when do symptoms usually disappear?
1 to 6 hours.
And when do they usually disappear? Just guess.
Sorry, within 24 hours. Sorry, I hit the wrong button.
Very nice. Wow. Look at you go. Okay, Logan.
What was that? I'm sorry.
10 for the respiratory system.
Okay, hold on just a second, Logan. It was how long does it take for symptoms to appear from ingestion preformed intro?
Oh, so this is just
Kinda
like
like food
general,
Yeah.
if there is something that's been preformed, what, okay, gotcha. I thought it was like a specific disease that we were talking about, or
No.
infection.
Okay, sorry, one more time, Logan. Respiratory?
Yeah.
Stephen went to the ER complaining of chest pains, weight loss, and was always tired, so he was fatigued. Personal history says that he was in to see the doctor a month ago with pneumonia. He has traveled all over the world and is usually a healthy individual. What could he have?
Is it tuberculosis?
Why? What in there showed you that you had
The traveling,
that? Good job. What else?
and being tired. Isn't that particular to tuberculosis?
It was under tuberculosis. I don't know if it's just particular to that one.
Okay, I think I just remember seeing it on there.
Yeah, it was under there, for sure. What else?
The weight, like, I don't know, I just remember the weight loss too, it was talking about like how, don't they cough up blood too at this point?
I'm not really
If I
sure
remember
about
right.
coughing up the blood at this point. I do remember, the one I've been looking for is it's a slow progression, but it could be caused by pneumonia. Like it could, it will show progression, if I remember right. Let's see. It's
Oh,
very
okay.
slow progressive. I'm trying to remember what that's called.
Doesn't say
Vacuolar to intercellular parasite, which includes. Why do I remember that? That's so weird.
What are you looking for?
You're right, they do cough up blood at this time. Where do I put that in there? Good job, Logan. For some reason, I remember. Oh, no. Because it kind of acted like it. That's right. How do you test for tuberculosis anyway?
Don't they inject antibodies into your skin? Or am I crazy?
No, they do this little thing into your skin that shows a bubble, and it's all red.
But what is it that they put in your skin?
I don't remember, but I get one done every day.
You do?
Yeah.
I've had one, I just don't know what it
Actually, I
is.
work
That-
stopped doing it.
Why?
I don't know. They just said that was our opportunity.
Well, that's kind of cool.
I just
Except when you get it. and-
I just got one the other day, actually.
Yeah, and you have to
Does it
go in
still
like
bubble?
in 3 days.
Nope. Yeah, you have to wait. You have to go back in 3 days later, and
Mine
they
left
look
a
at
scar.
It did.
Really?
It wasn't even positive. It left a scar, yeah.
Wow.
Right there, do you see that?
Well, that's sad.
I don't know if you can see it or not, but it just kind of looks like a pimple scar or something. I don't know.
You test, and this is a skin reactive test, but it does not always prove that you have the active disease. The time test with the old tuberculin, or the PPD, and the toxin test with the purified protein derivative. So that might be the protein that you put in. All right, Brigham.
Urinary and bladder.
You already went through this. Go on. Which phase of HIV infection is considered clinical AIDS?
3.
Why?
Because AIDS is when it's, you have 200.
200 T cells.
T cells per whatever, and it's where it's like downhill.
Johnny, good job. Okay, Moab, digestive or definitions? How about
Let's do definitions.
Okay. What do these abbreviations mean?
First one is sexually transmitted infection, second one's venereal disease, and the third one's pelvic inflammatory disease.
Very nice. All right, Logan. Ow. Alright, anything you guys want? That's rude.
Brigham?
Oh yeah, where are we at?
Kid's gonna shoot me.
We're trying to think of the name. Does it cause colitis or whatever? Possibly. What is it?
Enterotoxin.
Oh, enterotoxin. That's way simpler than I was. Because it's in the intestine. Duh.
That's okay.
I like tracking it.
Oh, and then we're gonna ask you too. On your final from when you took this class, do you remember how many essay questions he had on there compared to like how many multiple choice and fill in the blank?
I thought there was only 2 essay questions.
2, I think.
On the final?
Yeah.
But it's mostly multiple
Because that would
choice.
make my day a lot happier.
It's just the same. I mean, it's mostly multiple choice, and true and false, and then like a few fill in the blank, and then 2 essays, I think.
Yeah, it's pretty much the same.
Just
basic.
twice as many questions.
Yeah. It's pretty much the same
Yeah.
basic formula that he's used before. It's just twice as many. So most
Okay.
of it
So he tends to have. Does he tend to have more multiple choice then and true false compared to the fill in the blank?
very much so. Like I said, we only have
Okay.
2,
Yeah.
if that.
Okay, that's just good to know. Thank you.
Yeah. Any other questions on that?
Lisa, I have to leave. Thank you very much.
All right. Thanks for coming, hun. Good luck.
And so 40% of the test is gonna be that material or 60?
60 is gonna be this stuff.
The stuff that you have just learned. If I remember right, and 40 would be comprehensive, right?
I
Well,
thought it was the
wait.
other way around.
Are you sure?
My
Yeah.
Oh, because I'm in his same class for anatomy, and it's the other way.
Oh, okay, then I lied.
I don't
So
know,
60 is
though.
comprehensive and 40
Probably just
is.
because, like, how many he usually asks on the new material anyway, like on the other exams.
Yeah.
Maybe.
So, yeah, so it's almost like a full exam for the
But
last
then an
part.
extra exam on your other crap.
Yeah.
On the other crap.
Yeah.
Something like that. Okay, do you want to keep playing Jeopardy or do you want to go through questions?
Let's keep